Hello, I'm Dr. Brandt Gibson, and in the child's foot, one of the biggest differences between the adult and the child foot is the bone. Now, in children, there are some pretty significant differences. Children bones are continuing to grow, continuing to reshape and change, and because of that, they will remodel over time based on the pressures and so forth. A lot of times, for example, you can put a child's foot in a custom orthotic that changes the way they walk. And the bones, not just the tendons and ligaments, but the bones themselves will remodel some to that new position if they wear them enough. That does not happen in adults because adults' bones are typically no longer growing. And the idea here is these bones also have areas that allow them to grow. Because as you know that a child gets larger, the way that is happening is the bones have these soft areas of cartilage where you have a bone edge and a bone edge, and you have cartilage between that allows the bone to grow a little bit, put new bone down, grow a little bit more, put new bone down. And what happens when that bone growth stops, then the cartilage will fill in. So to help you understand, when a child is born, there are multiple bones in the foot, for example, that are almost completely cartilage. And a lot of times you're going to actually see changes over that period of time. For example, if you take the foot has the calcaneus, which is the heel bone. And at 6 months, you start to notice bone in that area. But a lot of times it doesn't completely stop growing in males from 17 to 21 and in females from 13 to 17, with the average being about 16 years in women and 20 years in men. So the foot can continue to grow during this period of time because it has a growth plate. Similarly, the talus will have bone that is present after the sixth fetal month, but is often fused in the 7th or 8th year, although there are sometimes portions of it that don't fuse until 18 years old. You've got the cuboid bone that is present at birth, but the cuneiform bones present at 1 year, 2 year, and 3 years after. The navicular is usually not seen until 4 or 5 years. A lot of the metatarsals will present at the 8th to 10th week of pregnancy, but they continue to grow throughout life, sometimes same period, 17 to 21 for males, 14 to 19 in females. All the bones in the body have a similar presentation. So you're basically saying, okay, these long bones that we have develop and change over time. What does that mean for the child's foot? Well, in the child's foot, that means that bones will break less easily. But they can be injured. So if you've got cartilage instead of bone, you can actually sprain the cartilage and cause a same type of pain, a same type of injury as it would be with bone, but it heals differently, heals quicker. Because bones are constantly changing and remodeling, they will also heal fractures quicker a lot of times as well. So what it comes down to is the child's foot, because of the way that the bones are growing, because of the ways the bones are developing, because of the way the bones are changing, is significantly different than the adult, and it needs to be treated differently, whether it's in the way that the foot's functioning, whether it's in the way that bones are healing, or even what types of injuries can happen. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 292, the child's foot, with a special focus on bone growth. So thank you, and have a great rest of your day.